Got
You're
it.
welcome.
It's recording now.
Okay.
All right, so welcome.
Okay.
Some of the, like I was saying, some of the, there were two updates that were put on the Dropbox for the adjunct and for the ortho. Nancy, I guess, put hers up there. And so if we just, I guess we don't need to worry about these submissions yet, right, Patty?
I believe not. I talked to Kathy Forbes,
Okay.
and apparently what we're asking for is not going to be able to be put into a code as such. We're going to have to come toward it, in a different direction. They say one thing in their CDT manual, and then they change it all the way through. So, and it becomes really confusing for everyone. You guys, if you look through it, it's kind of crazy. 1 minute it has a dentist, 1 minute it has a provider. It might say pathologist, it might say anything. And so we're going to have to frame some sort of a paragraph about what we want them, what we would like to request that they do. And some of the evidence will be that this is what they say themselves. And then we need to be able to gather evidence. And I don't know how or where. We have to contact ADHA. I don't know if the NADP will know. I don't know who's going to know this stuff. But to find out if it's causing any problems for any providers trying to do things. And that's kind of where she sort of left it with me.
Right. Like we talked, last time was the provider type language and how we need to support or substitute. As far as, let's see, the preface wording, I think is what you were talking about. This preface wording, the general practitioner, specialist, and other individuals, right? That's right. That's what we need to kind of work on.
That's what they say.
You said something about the word clinicians. Should we substitute clinicians for that group?
Well, it was because in the groups that I looked at, they actually used clinicians, like Patty said, they use so many words to describe providers.
Yes.
But at one point they did say clinicians in it, which I liked. I thought that was kind of an all-encompassing word instead of saying, or they did say surgeons, because some of the stuff I looked at was surgeons. Mm-hmm. They said dentist in some place, but really we're all clinicians of some sort, whatever our specialty may be. So I just thought that might be a word that we might consider. I don't know what you guys think about that.
So maybe replace, this with clinicians and other individuals may report any of the listed CDT codes within the scope of the state law.
I don't know. What do you guys think about that? You know of another word?
Do we have to come up with a word for it? Or okay, things are spinning around in my head. I'm thinking, okay, if if we say clinicians or we say providers or human beings, I don't know.
Right.
The point that they make in this preface is that it can be any individuals because they say other individuals. And rather than listing or having a laundry list of who might do this, because let's face it, different states say different things. We probably have 50 and DC versions of the Practice Act across the country, and different things are allowed for different people. So trying to use those words in the code becomes a problem. And it's confusing for all those individuals and all those states to keep it straight. And it's intimidating because some people will read the CDT code and not be able to maybe not understand that they have to look in the Practice Act. And by the way, reading a Practice Act is almost worse, pretty much worse than the CDT book.
Oh, yeah. Wow.
So it's like, could we not play kiss and keep it simple, stupid, and just find a word, whether it's clinician or practitioner or warm breathing body or whatever, rather than specifying all these different people. Because in some states, only dentists can do it, and in some states, hygienists can, and in some states, assistants and therapists, and they have licensed hygienists in some places, not RDH. You know, it's like, it's crazy. And they make it more difficult.
Right.
So essentially, whatever we want, whatever is stated in this preface to be universal throughout the whole book. That's really our goal, correct?
Yes.
Right.
I think so.
In reviewing my section, specifically D9311, consultation with medical healthcare professional, they refer to the variety of medical professionals as medical healthcare professionals. What if we were to list it as dental healthcare professionals?
Or oral healthcare professionals.
Yeah.
Oh, I like that.
Yeah.
I highlighted it in green.
Especially since they use those words.
Mm-hmm. Yeah, it's already there.
Uh-huh. I mean, we have pointed out the error of their ways before in things that they have done. And they don't particularly enjoy having their own words used against them.
I was going to say, and they're not ever too happy about that. So,
no, but
Hi,
at
hi
some
ladies.
point,
Sorry I'm late.
That's okay. Hi, Teresa.
Just got in from a client, so. Whew. Okay, let's go. What did I miss? Anything exciting?
We were just starting to talk about how to start rewording the use of the provider language.
Okay.
so did you find anything interesting?
For me,
Mm-hmm.
really, no. I was kind of surprised. The only thing that really specifies DDS versus something else is the 4341, the oral cancer screening code. It does say DDS looks for lumps, etc. I think if there's a case to be made that most of the time, at least what my experience is, it's the hygienist doing the screenings, then I think we need to change that language to, whatever you guys are thinking about, like, a licensed healthcare professional or not. But that was really the only one that was
Okay.
weird about that.
The 4341?
Yeah.
Okay.
Let me see. I can pull it up in just a second.
Yeah, both Vicki and I,
Oh, not the 4341. I'm sorry.
no, that's okay.
I
Go
didn't
ahead.
mean 43.
Ontario code.
Yeah.
I'm familiar with that code.
Yeah. Let's see. Where did I hate running in and being rushed like this. It just.
Okay, then take a breath and we'll talk about something.
Yeah, I was going to say, we can go on to the other codes. The restore.
Okay, I got it. I got it.
Okay.
Yeah. It's a 0431. That's the adjunctive pre-diagnostic test that aids in the detection of mucosal abnormalities.
And what was the wording that they used?
Let me go get my bigger book. Hang on. This is just the little one. I'll be right back.
Okay. Yeah, and like I was saying, both Vicki and I didn't find anything in these sections. The implant, Connie, you came up with these. There was nothing in the oral maxillofacial or the prosthodontics fixed. So it just seemed to be ortho, adjunct, and the ones Teresa found.
Okay. So it says, a basic oral cancer screening includes a visual and a physical evaluation. During a visual exam, the dentist looks for abnormal color and texture. During a physical exam, the dentist feels for abnormal lumps and bumps. Now,
Where does it
this
say
does
that?
not, that's why I was just saying, it's not on the CDT code under the procedure definition. It's actually on Dr. Blair's coding companion that breaks down the code even further.
Okay, but he's not. We can't change Charles Blair. No one can.
No,
I
I know. Yeah, I know. But that's the only
code
one
itself
that
says
really.
Adjunctive pre-diagnostic test that aids in detection of mucosal abnormalities, including premalignant and malignant lesions, not to include cytology or biopsy procedures. So that could be like, oh God, it completely left my mind.
So like the Belscope or Visalite oral,
Right.
I would use oral ID, yeah.
Yeah, and it doesn't say dentist. It doesn't say anything about the dentist for the actual nomenclature.
Right. So there's really nothing there. And with all the evaluation codes, when it talks about dentist, I mean, the dentist is the only one that legally can diagnose in that case.
Right.
And do those evaluations. So there really wasn't, I was surprised. I expected to find more stuff.
It says like image capture by a practitioner, processing, tests and exams. It doesn't specify. I'm looking further back.
Are you looking in the companion?
No, I'm looking at the, like on the comprehensive oral evaluation.
Oh, gotcha. Okay.
The 0150, it says used by a general dentist and or specialist.
Okay.
And it does.
Isn't that one of the places we're trying to get rid of it? Because there are states that.
Can we? But even though, see, that's the thing is I'm in California, and nobody but the dentist can diagnose. So and it does specify in these evaluation codes that, the other taking of the x-rays or the charting or the whatnot can be delegated, but it doesn't, it specifically says that, only the doctor can diagnose.
But in Colorado, a hygienist can.
Yep. They can diagnose. Okay.
So again, it's like,
I mean, we know that the State Practice Act takes trump, but does everyone else who's reading that realize that that's the case? And so then is that considered fraudulent when a hygienist in Colorado submits for a 150? Is that considered fraudulent because the ADA book says it has to be a dentist? We know that their State Practice Act contradicts that, but that's where it gets muddled for people who aren't familiar with the difference between CDT codes and state, practice act. So
Right.
I think
So
that's what we're trying to do away with.
right. So the only one that that I saw that actually says dentist is the 0150. Other than that, it doesn't say. So like on your periodic, it says an evaluation performed on a patient of record to determine any changes in the patient's dental and medical health status. Since a comprehensive or previous periodic, this includes oral cancer evaluation and perio screening where indicated and may require the information acquired through additional diagnostic procedures. The only one that specifically says dentist is the comprehensive.
But then there's
And
that
I think
there's paragraph in the clinical oral exam evaluations. Is that what we need to change then, that paragraph before, where it says it is the responsibility of the dentist?
Right. If I would assume that that's what we would need to change if other states can have their hygienist diagnose. Now, is that going to be a hygienist AP, or is that different in other states?
I'm sorry. Shut up. I think husbands listen better than dogs.
Oh yeah, I totally don't.
It also says, if you look at the beginning of the diagnostic section, it says clinical oral evaluations. The codes in this section recognize the cognitive skills necessary for patient evaluation. The collection and recording of some data and components of the dental examination may be delegated. However, the evaluation, which includes diagnosis and treatment planning, is the responsibility of the dentist.
Right.
When you read a code, it has to agree with not just the nomenclature and the descriptor. It also has to fall into whatever it says at the beginning of the chapter. So they're saying it a couple of times and saying this is the purview of the dentist. I don't know that they'll ever take it out of there.
Right.
But the point is, there are places where someone else can do it. A dental therapist can do it in Minnesota. And then we've got the Alaska people. And, there are different places where different things happen.
Right.
And
And then, oh, sorry.
Go ahead.
You were saying about how I wrote down what you had said about the cases. In Minnesota, if it's an ADT, then the billing is different. You end up getting paid differently, right?
Correct. That's what we've been noticing. And we're a critical access provider, so we are supposed to get we see probably about 85% Medicaid. And we've noticed that we have not been reimbursed equally if it's an advanced dental therapist versus a dentist doing the various procedures.
And are they saying it's because specifically? I mean, are they giving you any reason for that?
No, what we're doing is we're compiling a list, and then we are approaching the representative that works with us directly, because we're such a large office, to see about resubmitting for proper reimbursement, I guess is the terminology. But we just started doing that probably 8 weeks ago.
Mhm.
There's another gentleman, Edgar Lucero.
Yeah.
He was supposedly going to be joining our group as well. He's from Oregon, and he was saying that the dental hygiene diagnosis is able to be done with the RDHs in Oregon, but that the CDT code still says that the evaluation is the responsibility of the dentist. So they're allowed to diagnose, or they're allowed to do the diagnosis there.
And I guess maybe what ADA should do is put this, if they're not going to change the providers on it, maybe we could just have them put the statement like in bold print on every chapter, State Practice Act trumps what these words say. I don't know. Like,
So I'm just
people don't understand it. They have enough trouble understanding the code, let alone
right.
the Practice Act and all the fine points of that.
Does it say
Right. So
anywhere in the CDT manual about State Practice Acts trumping?
Yes. It's in the preface. It's in the preface.
Oh, okay, okay.
On the
I'm reading it. Yeah.
Yeah.
of the preface. It says, using the CDT code number 2, general practitioners, specialists, and other individuals may report any of the listed CDT codes as long as they are delivering procedures and services within the scope of their state law.
So why even go to the trouble of differentiating then? That's what doesn't make sense.
Yes. Yeah, it's really crazy. But no one, who reads the preface? How many, they don't emphasize it because they don't want people to know that, yeah, you could actually have someone else in your state do it, I assume. So it's like, well, why don't you just take the language out? You already said it. Who does cross-coding? Does any of you guys do medical cross-coding?
No.
I'm just starting to, but technically no.
I have before. It's been several years, but I have before.
It's a beast.
Yeah, I bet. But medical procedure codes don't list the practitioner, do they?
I
No.
would still think on the claim form, though, wouldn't you have to differentiate a specific treating provider?
I don't know.
Yes, in terms of provider and who's getting paid, but the codes themselves say nothing about provider.
Right. The code, yeah. Okay.
Because of the fact that they probably have many people that can do those procedures.
Right. Some people are, I have a friend she's now a nurse practitioner, but her hospital cleared her to do procedures that now nurse practitioners can do, but she was just an RN. But they cleared her to do the procedures years before she became a nurse practitioner. And they could do it on a hospital by hospital basis.
Mm-hmm.
So, yeah. I don't know. By their own words, it's okay to do it. But then they put limiting language in all the code, not in all the codes, but in some of the codes. It's like, you can't do that. Well, you can do that. You obviously do it, but it's confusing and intimidating for some people because they think, oh, wow, this is what the ADA code says.
Right. I think it could be arguable if on the preface, it's the general practitioners, comma, and specialists may report. But the fact that it says other individuals there, to me, nulls the argument.
Right. I think even somebody said something. I think you could, if someone complains somehow, you could argue the point. The CDT code says my practice act says it's okay. You can't sue me for doing this because my practice act says it's okay, even though the CDT code says no. So, yeah, I don't know. But somehow we have to come up with some kind of an opening paragraph to say,
Well, Patty, you know as well as I do, every time this gets brought up at CMC, how quickly they shut it down.
I know. I feel like a drop of water hitting the stone over and over and over.
Well, even water makes an impact
That's
in
right.
stone over millions of years.
It may take that long. They'll change it over my cold, dead body.
That'll be the last thing on the tombstone. Oh, we finally got it.
She got the code changed.
Yay. What about, I mean, why couldn't the descriptor under clinical oral evaluations, that leading paragraph, I mean, they just take that one bracketed sentence out. The evaluation, which includes diagnosis treatment plan, is the responsibility of the dentist, and put the responsibility of the licensed individual.
Mm-hmm.
Because that's kind of what it matches general practitioner, specialists, or other individuals. Doesn't really say.
You know, I think
Hygienists particularly, it just says other individuals.
I don't understand why they won't put other language in there, except that I think they have political groups who are holding on to the fact that the dentist must do everything. And like they're never going to let it go.
Right.
The same ones who got scared when, Colorado got independent practice. And, it's just been, there's been a surge of hygienists opening their own practices because Colorado got independent practice. In 1985, so, but again, we have to at least make a formal petition about this and ask them again. And Natalie, I think some of the information that you have about this is what my practice act says, this is what's happening, we're not being paid. And I think that's a compelling reason for why they need to come up with taking out this language, or somehow saying whoever is, your state practice act trumps all this. It's okay. Mm-hmm. It shouldn't be paid at a lesser rate.
Yeah, no, it absolutely should not.
You get paid at a lesser rate if your nurse practitioner does your bone biopsy or the physician does the bone biopsy. No?
No.
You know who would be a good person to provide testimony is the advanced dental therapist that I work with, Christy Fogarty. She's also the Board of Dentistry president right now.
Oh.
And a hygienist.
Oh.
And she likes to stir the pot.
What's her last name?
Fogarty. I'll send you her email.
Oh, okay.
Yeah.
Awesome.
But yeah, she and I had a discussion last week about why none of the therapists are billing out the 0150. And it's because of the way it's written. that it states a dentist, although they all see brand new patients. They just don't use the appropriate code.
Mm-hmm.
So Natalie,
Yes.
take the CDT book
Mm-hmm.
and show them the last page of the preface, which I think is, I don't
Mhm.
know, my Roman numerals aren't good.
4.
It's number 4.
Right.
And it says it's within the scope of their state law. Other individuals may report.
Yeah, I asked Christy what it would take, and she said that our office would have to be in agreement because once we start billing, she is pretty definite that whoever starts billing will end up in front of the Board of Dentistry Complaint Committee. But then it'll be okay because it's legal in the Practice Act.
Right.
But you know, the dentists like
Nobody
to
wants to
control
do
everything.
You know, seriously, Natalie, we sat at the Board of Dentistry meeting at the CMC meeting last year,
Mm-hmm.
and the head of the CMC stated, State Practice Act trumps anything written in the CDT. He said that. And we
See, that
said,
kind of
"Please say that
surprises me.
word."
Right.
And he said yes. And you might ask, I don't know if Patty has it. I don't know if it came out. I don't know if it's written down somewhere. I can't remember. But yeah, we pushed, I think Kathy Forbes might have pushed him on that. So there should be a transcript somewhere that says that.
Mm-hmm.
Do you think Kathy?
I will bring it up. I'll bring it up at the office again, and you know, hopefully we can start appropriately billing those comp exams.
Yeah, you're seeing new patients, for heaven's sakes.
Yeah.
That's so not fair.
So are you just thinking about like having the dental therapist or the hygienist that can do that, they're billing out for the comp exam? Only because the question I'm bringing up isn't really as much a coding question as it is a teledentistry question. Because I just launched our teledentistry services a couple of months ago, and that's kind of the rub right now is we do have a partner dentist that's viewing this data because my hygienist is not an AP as of yet. So he is viewing that data, and they're billing out for basically a limited and they're doing that because it says problem focused because his patients typically are complaining about there's a health reason that they can't get to the practice, or there's a complaint about gums being sore, because most of them obviously can't get there or they would. So how does anybody feel about that? I mean, anybody that's using teledentistry there, and what are they doing?
We also bill out as a limited, and most of the teledentistry exams are done by the advanced dental therapist. I hate to say it, they're more thorough.
They are, absolutely.
Mm-hmm.
I'm in total agreement with most hygienists that I know are better diagnosticians than most of the doctors. Hell, I'm even a better diagnostician than most of the doctors, just because I don't have a DDS or an RDH behind my name, but I teach radiology, I teach risk management. I've been doing all of these things for 40 years. I know what I'm looking at, and sometimes you look at something and go, okay, so you don't see that big hole there? What? Okay. What am I going to do? Can't make them diagnose. So frustrating, but okay.
Yeah.
So it sounds like the overall is more instead of individual codes, it's more of an overall preface that we have to change, where they have to delete the general dentist and or specialist. It sounds like.
Right. For the diagnostic
Right.
reasons.
Or
Because it
if
does
they went
clearly
through
say
it and
other
they-
individual.
Yeah.
They just made it consistent.
Well, didn't you say that they're always saying that they want consistency in the CDT codes?
hmm Unfortunately, what they say and what they do.
Oh, okay. Yes.
And they have their political factions.
I was just going to say, is this more of a, what do you call it? Lobbying kind of? Is it the money? Is it just?
I think it's ego.
Okay.
Yep, it's the good old boy system.
Yeah.
Even though there's a few women in there, it's the good old boy. It's the good old boy system.
Yeah.
Yeah.
Okay, so.
Well, in this case, I think on this first slide that's up, we can delete that, the 0431,
Okay.
because the nomenclature actually doesn't say that as much as the explanation of it on the companion.
All right. All right, so our next step would be, what would be our next step, Patty, is just reporting this to the meeting that we're going to have on the 14th?
Right. We need to have some kind of a paragraph. And I'm sure it'll be blood all over, edited, re-edited, twisted, turned, whatever. But we need to come up with something.
I say we just throw their words right back at them.
I'm good with that. But we need to put it in, write it down.
Right.
In a non-emotional, logical way. And we're also going to need to have examples and reasons. And I think particularly Natalie and Teresa, you've seen things and you have reasons. Those of us who have been able to practice in different states realize that I can't do anesthetic here and I can do it here, and all the little quirks of the practice acts. And so we need to start having not just that first opening statement as to why we want this changed or what needs to change, but some information to back it up. We've seen this problem. This problem's been reported. This problem's been reported. I don't know if ADHA has any file. Possibly somebody could call them and ask if there's some sort of a file from hygienists who have had issues with this from different states about what they can and can't do. I don't know where that would be. Possibly somebody who's gone through some sort of litigation or something before the state board. When I said litigation, I thought maybe malpractice insurers would have that information. I never thought of that.
I would also probably look to, let's just say if it's going to be Delta or Guardian or MetLife or anybody, are they going to produce their written policy that says that we pay less, or is that just something that somebody arbitrarily kind of decided on the fly because now we're seeing other people get involved, not just the dentist. So, you know, maybe we need to pay them less. Is that in their written processing policies?
Yeah, that would be interesting to know.
Well, you,
I don't know how anybody would get a
I
hold
was
of
going to
that.
call the National Association of Dental Plans, and that's something I can ask them to see if they're refusing to pay or if they're paying less for specifically, if that's like a protocol that they have.
Yeah, are there two
Right.
tiers of payments? And yeah, I'd like to ask them, are there two tiers of payments for when, let me see, the dental, in Illinois, dental assistants have no training, none. They walk in off the street and they are a dental assistant. And when they're taking x-rays or when they're polishing, doing coronal polishing and placing sealants after 8 hours of classwork,
my.
are they paying less for those than if
That's an
a hygienist or a dentist or a therapist did it?
Yeah, so does a hygienist get paid less for a sealant?
That's a good question.
Yeah.
Well, that would only be if they provided that. It's all under the provider of the practice, isn't it? As it's sent into the insurance, or is that supposed to be sent in under the hygienist provider?
In places where hygienists can do that sort of thing, it would go under the hygienist.
Depends on the insurance.
Yeah. Yeah, so there's a lot of things that, like, are we paying on two levels here? Are these considered substandard, perhaps not as good? We're not using the same materials, the same technique, the same everything, and suddenly you're paying less for this because the dentist didn't put his finger on it?
Right.
I actually
What
think
about-
there's data out there stating that hygienists and assistants place better sealants than dentists.
Oh, I'm sure.
Something I heard at a sealant symposium years ago.
Ah,
Yeah.
I worked for a dentist who was terrified of sealants.
They're
What
pretty
is your
scary.
problem?
Yeah.
I know, poor princess. What what about state insurance commissioners?
I don't
Could,
know.
I mean, patients can file a grievance, a practitioner file a grievance with an insurance company because they're paying them less. They're discriminating. Discrimination.
Yeah.
So I wonder how far that would go if a hygienist AP or in a state that allows that consistently got paid less if they could just file a grievance. I wonder what the outcome on that would be, how that would look. Do we know anybody nervy enough to do that?
I'll do it.
I mean, I was going to say, I'm asking the wrong group of women, but
Oh, no.
as I said that, I thought, well, that was a stupid question. That would be interesting to see how that might play out.
Yeah.
Because then do you get to charge the patient less? Because the whole thing then is, you know, misguided.
Yeah. So
They can start telling you what you can charge.
when you go to the ER because you have a bad cut, and the doctor says, yeah, that needs to get sutured, and he sends in the NP,
Mm-hmm.
what gets paid?
Yeah, your suture.
Or you're having surgery, and your surgeon does most of the stuff, and he has the surgical tech close because they don't always do it themselves.
Right.
It gets to be ridiculous. Who does what, and that's what you pay it on? It doesn't work that way.
Right, because if you're diminishing,
By a procedure,
right,
it's a procedure. It's not about the person doing it. It's about the procedure. If it's the same procedure, it should be paid the same.
exactly. Because let's say sealants are $25. If the doctor does it, they're going to pay $25. If the hygienist does it, are they going to start limiting what you can charge the patient? So for a fee schedule, it's going to only go to $20?
I don't know. Don't give
It
them that
doesn't make any
idea.
sense. They'd have to prove it. Prove it. But that's kind of the scenario that, you know, the round robin I could see. Like, well, if you're discounting my fees, then you're saying that the service is being done less than, I'm less than a dentist.
And then are you providing substandard care?
Right. Yeah. And if we are, wouldn't you want to pay less for the procedure? I mean, it's ridiculous.
Yeah. So anyway, that's part of what we have to do. And those are kind of, we have to put this into a written form and submit it to them. But we have to start with that first paragraph and then start listing out the different supportive claims. You know, like the inability, because of what it says in the CDT, even though it says that it trumps, they're not filling that out because for whatever reasons, and they're not paying those because it's not an actual dentist doing it. All those sorts of things, or where those are happening. We need to show it's happening across the country, different places, not just one state, but as many as we can find, and say this is a problem.
Right.
And your words in here are causing the problem and the confusion with what's supposed to be a simple procedure code.
That doesn't make sense. I would probably just throw their own words right back at them and use section number 2.
Yeah.
Instead of trying to reinvent a new paragraph, just put that right there. Say, this is your statement.
And then you put all these other words in there. Yeah. We just, for clarity, we just like to have another word used, insert. It's an editorial change. Just remove and replace.
Mm-hmm.
But we do need to cite where there are places that there are different providers, because there's a multitude of different providers that they list. You know, they say dentist specialists. I don't know if somebody said, Patty said she saw something for pathologist.
Oh. Yeah, maybe in some of the biopsy things, there might be some language like that.
So.
Yeah, are they going to pay the pathologist less?
Yeah.
They're not a dentist?
Yeah, I don't know. So that's the kind of stuff that they have to stop doing. And that's what we need to tell them. But not make it seem like we're telling them, because we don't want their little egos to get too squished.
Oh, yeah, that would be terrible.
Well, I do, but.
Yeah. So if you'd like, I could put together a list of all the things that we found for the 14th, and then do we want to start emailing each other a paragraph, or does somebody want to come up with wording, or just maybe take out dentist and general dentist and just use other individuals right now?
Or like licensed providers. I mean, you wouldn't want, I don't think necessarily to say other individuals, because it could be an unlicensed DA.
Gotcha.
If you want to argue that point.
Oral health care professional?
Licensed oral health care professional. Because even though like the dental therapists, they're still licensed. The RDHs are still licensed. So I think maybe they would get hung up on somebody not being licensed. licensed for
Sure.
that particular procedure. So if we just leave the word licensed in there, that clarifies that, it's not just the DA, it's someone that actually is trained in this procedure.
Well, some of the
Appropriately
DAs are licensed, aren't they?
Yeah, there's about
Right,
7
but-
states that license their assistants.
Yeah.
Yeah, now California can have an RDA. So I'm an RDA. I can do sealants. I can do cornel polish, all that, because I took that class. That's extra for me.
Right.
Can't you also place
And I'm
fillings?
If I'm an EF, I can.
Ah,
See, and I can in Minnesota as an LDA. I took the additional training.
gotcha.
Yeah, so it's an EF to do those things in California, but just a dental RDA can do sealants. We can cornel polish. Like that.
So yeah, it
If
really
you have
needs
that
to
extra
be
training.
licensed oral health care professionals that are according to the State Dental Practice Act or, whatever, under state law. Because so many different people can do so many different things.
Right. Just within our group, listen to this.
Yeah.
It's crazy.
All right. So I will put together a sheet for the 7/14 meeting with that language and then a list of all the ones that we found. And then Natalie, can you contact that Christy?
Actually, I sent you her email addresses
All right.
about 6 minutes ago.
Okay. All right then.
Okay. Somebody's going to keep us on track here.
That's right.
I'll send her a heads up text to be expecting an email or something.
An inundation of people.
No, she likes controversial things.
Great.
I like her already.
I know.
When she come to Chicago.
Well, she ran for the DH Board of Dentistry position, and the State Hygiene Association didn't support her. So
Oh,
yeah, because she's an ADT. That's why. Because she's an advanced dental therapist, and we don't have a position yet on the board for that.
no.
Oh, my God.
Crazy,
See, this
huh?
whole politics thing. Come on, people. We just need to get along.
It's crazy. All right, so what's our next step? Meeting on the 14th?
Yes, the meeting, so this video will be ready, and then, yeah, the next DCC meeting is that Sunday, the 14th, 7
Okay.
o'clock Central. And that Patty should be doing that, Patty DeGangi.
The real Patty.
Yeah,
This is a real Patty.
that's right.
Funny.
The official Patty.
The official Patty.
Yeah. So, yeah, so she'll be, and I guess we'll be talking again about what all the other groups have found out too.
Right.
Yeah.
Well, thanks so much for your help tonight. If you can think of anything else we need to get ready for the 14th, I guess if somebody wants to call Medicaid to get a list of what providers are allowed to do under Medicaid, ADHA has a reimbursement list that I downloaded for each state. They have each state as to what the state Medicaid department directly reimbursed dental hygienists for services rendered. So is that what they're talking about, Patty? As far as a Medicaid list of what providers are allowed?
I know the reimbursement is different. I assumed it was different by state.
Yeah, it is. Do we need that?
I don't know. Maybe it's just information we should have. I don't know.
Okay.
I don't know what it says. So gather all the information. We'll use what we can. The rest will.
Okay.
Is there anyone else from California on this call?
No, I don't.
I'm just wondering about APs, hygiene APs in California. can they become Denti-Cal providers?
And maybe that ADH, well, I don't know. Maybe that ADHA list would clarify that.
Mhm.
Well, it says from California.
Yeah. If they're APs.
I have no idea.
Yeah, I'm not sure either, but that would be
Trying to think.
something to find out. Because that would be good to
Denise-
know, like,
Denise-
I'm talking from
Denise-
a teledentistry aspect.
It says something.
Denise Narsky was in California. I think it's Denise Narsky Herring. She's an insider. I know she just moved to Florida, but she was in California. I don't know how much she would know about that, but
Okay.
it's
Well,
easy
I
enough
mean,
to contact.
yeah, and I mean, my hygienist can find out too. She's getting her AP and she's going to school September, October. So by December, she will have it, which will be better for our teledentistry stuff. But I'm just wondering about opening that up to her being able to bill certain things for that.
It does say that, according to this list, is that the AP may be covered as long as they are within the scope of the Denti-Cal benefits.
Right. Yeah, so maybe that would be good. It's really hard to find a Denti-Cal doctor. It's almost
really?
impossible. Terrible. Terrible. And the ones that you can find, you don't want to go to.
Okay.
Yeah. That's a shame. All those people.
It is a shame. It's terrible. And the demographics around here are just, there's a real high and a real low. Because of just the Central Valley, there's a lot of agriculture and things like that. And a lot of people are seasonal and they're on Denti-Cal. And they don't have good service. And we want to help provide that for them. But we get kind of stuck because we can't bill. Like, we're willing.
All right.
Like, here
Thanks.
we are.
Thanks, ladies. We'll see you,
Thank you.
on the 14th.
Okay. And in between, you can email back and forth with ideas on how to say this.
Okay.
Because we just have to have some kind of a paragraph.
I'll put out a
It says-
paragraph, and then everybody can make additions or edits and whatnot, so that we kind of
Okay,
have a consensus by the 14th.
Okay.
All right.
Sounds good.
Sounds good.
Thank you so much.
Thank you.
Bye-bye.
Good night, lady.
Bye.
Bye-bye.
Bye, everyone.
Bye.